Where do I put my money in healthcare next?
Hello, everyone. Apologize a bit. I'm a little nervous. I haven't been in public for a few years. It's a little strange what's been going on. Well, I'm really excited today. There has been so much great information in this conference about what's going on in the space. So with this great panel, I'm excited to learn about where the great opportunities are in investing in the health tech space. So briefly, my name is 𝐂𝐨𝐦𝐬𝐬𝐻𝐡. I'm a investor and serial entrepreneur where I focus on digital marketing and growth. I'm also the host of the Beyond 8 Figures podcast, where I interview successful entrepreneurs about their own entrepreneurial journey. So here, if I can do this. I'm not as good as a lot of other people. I need my notes. Health tech investment has been steadily rising over these past 5 years. COVID, while creating an unprecedented crisis, has also created a rapid and large-scale response with a surge in investment. We're seeing a rise of virtual care, increased focus on mental health and well-being, and a push for quicker drug and vaccine candidates discoveries. These are just some of the things we're seeing. As health tech continues to grow, the only logical question is where do we invest to accelerate this growth and support a tremendous amount of social good that can be done by integrating technology into the healthcare space? The goal of this panel today is to answer that question, and hopefully more. Here. So let me introduce our panel today. Mikko Puhakka is the founder of Lion Partners. Mikko is one of China Accelerator's most active mentors, engaging in teams one-on-one. He's also the founder of Lion Partners, a consulting corporate financial company. He works with both private and public companies, such as UNL Global and Revenue Capital, as well as NGOs such as the Finnish Business Council of Malta, where he is the president. A fellow moderator earlier in the day, Julian Molitor, is the co-founder and CEO of FetoLife and the founder and CEO of Invenion. FetoLife has developed the first app that uses AI to support a healthy pregnancy. And in Invenion, Julian is now taking it a step further, building innovative products in the digital healthcare space, together with a network of industry-leading experts in data science, IT development, and healthcare. A missing guest? All right. And Marian Zamet. Marian is the head of Investment Promotion Unit at Malta Enterprise. Marian holds first-class degrees in biology and chemistry from the University of Malta and a master's of business from the same university. Always great to talk to another fellow chem major. At Malta Enterprise, she supports various sectors including medical cannabis, pharma, and other sectors of national interest. This past June, Marian was assigned to the lead of the Investment Promotion Unit. All right, let's get into some questions. Julian, what health tech sectors are you most excited about these days?
I think I'm most excited about AI and all this virtual reality, what we just listened to in the last talks. But I also always make sure that we shouldn't be only visionary. We should also think, where is the concrete need? What do we have to develop right now? And I think that really depends on which geography you're looking at. When you look at developing countries, I think there's amazing potential. So I'm really excited about this when it comes to digital health. When you think about my home country, Germany, we really have to start at the bottom and really, for example, do some data interoperability and make sure that the groundwork of telemedicine works. This is something I'm also excited about because I think there's a huge value add, and we shouldn't always think about the visionary things without doing, the concrete things that are needed right now.
Making sure everything works. Miriam, what are you finding exciting?
Well, MedTech is a very interesting sector for us.
Yes.
The way we go for different sectors at Malta Enterprise is a very structured approach. So we tend to research and evaluate different sectors because we want to make sure that when we approach a company, we have a win-win situation for both. So in order to do that, we analyze what our strengths are and what our limiting factors are as well when it comes to specific niches. And we try to understand which sectors and subsectors are a match for us and for them. MedTech is a very important sector, as I said before, and mostly because we believe that we have the necessary strengths and skills which lend themselves very well to this ecosystem. We are seeing that most companies in this sector are startups with very innovative ideas, and Malta's ecosystem in that respect, and I will go into further detail maybe later on, lends itself very well to that business model.
Very interesting. Well, Mikko, you have such a broad international experience. What are you finding exciting now?
Well, I have a bit of a different angle into this because my focus isn't exactly on MedTech or healthcare as such, but it's more on software. And I think it's pretty much almost exactly 10 years ago that Mark Andreessen said that, software is going to eat up the world. Now, what I'm seeing with a number of the companies that I'm involved with right now, purely on software, that the MedTech and healthcare, like we've actually heard earlier today, is starting to eat up software more and more and more. So even with the projects that we were not really looking into MedTech or healthtech at first, now we are getting demand. So it wasn't that we were looking for those opportunities, but the opportunities came to us when we were building certain types of softwares that are solving some very, very unique problems. So it's more of a kind of a demand thing instead of looking at the opportunities.
Do you see post-COVID a change in the investment space?
Yeah, well, investing during the COVID times was difficult because I think that one of the key things is to find a team that you can trust. And typically that happens in face-to-face meetings.
Yes.
That's kind of the essence of it. And during the COVID time, suddenly there was no way of actually physically meeting the teams. So most of the VCs, investors, public sector workers had to kind of reorganize that. Can we actually do these things online? Now it's kind of getting a mix. So there was like a lot of new habits that were being learned during the COVID time. So now it's kind of like a hybrid model in that. Also, I think that we learned during the COVID that if everyone works together, we can actually do things very, very quickly, which is kind of it's interesting, it's a bit scary, but it also kind of opens up a new perspective. In China, I got actually used to that kind of a model that, that you set your mind and then you execute super, super quickly. In Europe, we are not that good at it. In the US, people are pretty good at it. Asia, they excel at it.
Yes. Is Malta going to be changing its focus post-COVID of where they're putting the emphasis on the important sectors?
Rather than changing its focus, it's more like the pandemic catalyzed a certain interest in certain areas. So for instance, if we consider MedTech, I believe MedTech has been there for quite a number of years. Who hasn't Googled his symptoms on the internet? Who hasn't come down to a self-diagnosis?
Yes.
So it has been there, but now we need more structured systems on how to access it. So yes, there have been changes in our approach because we are more focused on this sector because there's more opportunity and there's more innovation, and all that I believe has been catalyzed by the pandemic.
Julian, with working with your network of experts and exploring where AI is allowing you to go, what are you seeing as COVID kind of hopefully leaves the stage soon?
So what I can really see is COVID drastically changed a lot for all the stakeholders in the system. On the one hand, politics has understood what has to be done. In Germany, we really pushed a new legislation forcing all hospitals to digitize their hospitals. Also, the doctors really understood what the benefits of digital health can be. Previously, they were quite hesitant because they always thought that can actually steal their jobs in some way. But I think many people now understood it doesn't. It adds some value. And also the patients, we have to understand one reason why, for example, in the well-developed countries like France, Germany, digital health is not really so advanced is that the patients just don't want it, Yeah. They are so used to getting to the doctor who's close to them, they don't understand that telemedicine can add some value. And now they understood, and I think this is a real game changer.
Miriam, what sectors do you think within MedTech do you think would benefit the most from Malta's, more emphasis from Malta?
We are looking at various sub-niches of MedTech. So, for instance, the use of an AI in assisting treatment, for instance, in imaging, in orthopedic surgery, in various disciplines of medicines, in telehealth, but also in wearables, for instance, how a wearable can give certain indicators of your health, of the way your body is working, and how that can give information both to yourself and to the healthcare professional. We're looking at companies that are providing platforms to better manage certain conditions. Yes. So, for instance, how to better manage a condition like chronic kidney disease. We are even seeing platforms in mental health care. Mental health care is a very important subject nowadays, even more so because of the pandemic. And we are seeing a number of platforms arising where a person does not need to go to the psychiatrist, to the healthcare professional, or to the psychotherapist for a first assessment, but can do that through an AI-driven platform, for instance. So those are all extremely interesting sub-niches for us. Another area where we're looking into is technology applied to fertility. Yes. So as you see, technology is something that can be applied in all sectors of medicine, and we are willing to explore each and every one of them.
No, those are all very good. Yeah.
Yeah, I would kind of like to add, because now I've been in Malta for almost 6 years. And I think that one of the advantages Malta has, it has a very progressive regulators in number of things. So there was an earlier talk about using Malta as a test bed. So there's a number of countries within EU, like for instance, Finland, which doesn't allow many things, and the regulators are very slow and kind of follow the trends instead of kind of more in the setting seat. So they could benefit from the fact of the regulators over here.
In fact, that's one of the things I wanted to elaborate a bit on. Please. Malta being small and somehow geographically bound, being an island, lends itself very, very well and ideally to be used as a test bed where companies can trial out and pilot test their technologies. The population in Malta is geographically bound, is trackable, is traceable, so even when it comes to clinical trials, it's an ideal solution. And apart from that, being small, we have access to stakeholders. So we have excellent, as Malta enterprise, we work very closely with regulators, such as the Malta Medicines Authority, such as the Digital and Innovation Authority, such as the General Hospital, the University of Malta. So part of our role as Malta enterprise is to actually matchmake and introduce companies to stakeholders in order to try as much as possible to enable collaborations.
And you have beautiful weather too.
That's another USP.
And if I can also add a small comment here, because I think digital health and MedTech can be of big benefit, especially for countries like Malta. Also smaller countries who don't have such an advanced healthcare system, for example, like France or Germany. We can see it. I think the country which is as a best digital health system in Europe is Lithuania. They really had to rebuild their entire system after the Soviet Union. They were really clever in doing it. And people are much more open to innovation. I have the feeling, and I cannot, of course, say because I'm not living in Malta, it's similar approach here. People are much more open. Politics is enforcing all this, while in Germany, you know, the system is good and people don't really understand why we have to improve it. And at some point in time, they will wake up and see other countries have a better system.
As investors, we try and look into the future, let us say, and hope that where we put our money is going to put us in a good position for the future. As you look to software eating the world, what do you see being really interesting in 10 years out?
Well, there's a US investor, 𝐂𝐸𝐴 that once stated that he looks at things like very simply. Like someone was asking him that why does he keep investing in e-commerce? And his reply was like that he asked himself a simple question: does he think that there's going to be more e-commerce in the future or less? So like right now I'm kind of asking myself that is there going to be more use of software into MedTech or less? And the answer is kind of obvious.
Yes.
It will have different formats and so forth, but it's going to be an exciting ride in the next 5 to 10 years. I mean, the technologies are getting so much better. I mean, AI is just starting to come in.
Yes.
We have quantum computing coming in, which is going to allow so many more things. Combining, you know, the ability to look at big amounts of data that we are gathering better and better through various ways. Combine that with AI, combine that with quantum computing, then you start to getting like such a good views of what you can actually do. So, I mean, the possibilities are endless.
It's getting to be really exciting. Julian, how about yourself? What are you looking at 10 years out there?
Sorry.
I'm
sorry. I think actually it sounds dry, but I'm really most excited about data interoperability.
Yes.
People always mention AI, VR, but honestly, it will not work out if we are not having interoperability of the data. That means patients' health data, also process-related data in the hospitals, everywhere. And if we are not getting these things done, we can be as visionary as possible. It will never work out.
True. Miriam, what's exciting for Malta over the next 10 years?
Well, recently I have just attended a huge tech fair in Dubai, and one of the prototypes was this robot doctor to whom you go and actually tell your symptoms and he gives you a diagnosis. Do I think we'll ever get there? Not in the next 10 years. I think patients still require human interaction. But if we're looking at the use of AI, at the use of augmented reality, especially when it comes to training healthcare professionals, that is definitely something which we need to take up. Even the use of software and AI in diagnosing patients. There is a plethora of data which, if accessible, can lead to better diagnosis and better outcomes. So I think that is what lies ahead in our near future and in the next 5 to 10 years.
Well, I'm excited to see what happens here in Malta, because it is always beautiful to visit here. All right, everyone, thank you so much for listening to us. Please give our panel a warm welcome. Thank you, everyone. Thank you.